As a practicing anesthesiologist for 35 years, I can say with some confidence that this is unadulterated, dangerous nonsense that will do damage to your unsophisticated audience. So this is a comment on a live that I did when explaining the danger of what anesthesia does to brain development. That the point of view from my patient clinic is that I get the patients after surgery. My clinic is specifically focused on peak brain performance. And when you look at the functional MRIs of patients who've gone under anesthesia, I'm right. They have damage in every single one. How well they can repair is in part what this clinician is saying, that, oh, it's related to how long they were under anesthesia, how sick they were before the surgery started. And I'm saying all of that should have been addressed and disclosed to the patient before you put them under anesthesia. So he goes on to say, while you're at it, why not explain how sleeping tablets always cause brain damage? Also not true, as any who have taken them for many decades can attest, unless used in overdose, especially with other drugs. Sleeping pills are not good for people who are trying to repair their brains from damage. You need the deepest depths of sleep, for which most sleeping pills, I can say all sleeping pills, prevent the deepest layers of sleep. You know, the one needed to repair the brain. The risk from anesthesia is mainly related to the risk of surgery. Okay, so what he's saying is the patients are really sick and they're coming in for surgery. Yes, what I'm saying and what I was saying in that video is if you do not need surgery, if it's an elective surgery, do everything in your power to avoid the surgery because it does cause brain damage. When you do surgery and the anesthesiologist is in charge of regulating the heart rate, the blood pressure, the ventilator, the perfusion of the brain is not as good as what the human would have done in real time. That anesthesiologist takes on the risk. It's part of the risk of surgery. What I find contentious is it's not explained to the patients. Those folks recovering from surgery, the ones he writes about that are at high risk, they come to me and say, why didn't anyone explain that the damage in my brain was predictable and known before the surgery? I mean, it was an elective gallbladder surgery, and the brain damage in the 82-year-old was ridiculous. Now her family says, we can't do anything about it now. And he writes, obviously bad things can happen during anesthesia, like anything that interferes with the continuous oxygenation, such as loss of airway or serious drops in blood pressure, hence the brain perfusion due to blood or fluid loss, which is related to the trauma that's required for life-saving surgery or the surgery that becomes bloody. Yeah, you're talking about a critical situation. I'm saying the number of patients that go into that operating room get induced into an anesthetic state where you do alter the perfusion of their brain. They're not being told that it causes brain damage. It does cause brain damage. It has to. You're changing the perfusion rate from what your body would have done to what the medical team does. And it has consequences. I'm not trying to scare people away from surgery. I'm saying don't do it if your body isn't in the best condition that you can get it in before the surgery. And personally, avoid it at all costs if possible. So say every one of your brain cells. Why would patients do an elective surgery? Oh, they listen to their doctors. They listen that needs replaced. Don't talk about that the body should be carrying 75 pounds less fat and improving the body mass and the metabolic state of their body might remove the knee pain altogether, even in joints that are totally destroyed, according to the radiologist. I've seen it. I've seen it over and over again where when the metabolism of the body improves, when the body mass decreases, elective surgeries are often no longer needed. This has been exhaustively examined by the anesthetic community for over 50 years. Well, when those anesthesiologists and surgeons are done, they send the patients to the internists, the people who prevent long-term disease or manage those long-term diseases. And the brain injury data is real, especially the higher their metabolic disease state before the surgery. This anesthesiologist and I probably agree on more things than we disagree. He says, your recent takedown of Dr. Berg's dry fast nonsense was commendable, but somebody needs to do the same for your Every anesthetic kills brain cells. I did not say every anesthetic. There are several ways to induce anesthesia, like topical or spinal cord, that do not require the anesthesiologist to perfuse the brain because the brain's working throughout the whole time. I'm saying when you take over and you have a metabolically ill patient, the brain cells you kill, you don't get to notice because I shoot cleanup for the next 10 years trying to get them back to peak brain performance if we can. I do appreciate the comment. So if you want to see that takedown of Dr. Berg's video, it's in the next video. I'll see you there.